I don't have a list here marking them off like you do. So let's do some, since we did hantavirus last, let's do some more that start with a H. Okay, without looking at your list. Anybody know of any other viruses or virus diseases that start with an H? Oh, yeah, okay, just one at a time. You say herpes first? She just started rattling them off. Okay, let's do herpes. Herpes simplex 1. Herpes simplex 1. It's the one that causes what condition? There's a couple of common names for them. What are they? Fever blisters / cold sores. There, what would be the mode of transmission? I think I read Chelsea's, well, I can't read her lips there. I don't think she said host to host, but yeah, it's host to host. And if you've ever infected with herpes simplex 1, do you know how long you carry it? How long you have it? For life. Okay, if you've ever had a cold sore, you're stuck with that virus for life. Next, let's put down that the receptor sites can be anywhere on the body. But they're most commonly found on the lips and maybe in the nose. But we have, what are I think I've already spilled the beans. What do you call the places that viruses attach to a cell to infect it? Yeah, receptor sites. I just want to pick it out of you and I spill the beans there. And I hate that my laser disc player is an 80s vintage and there's no way, well, I guess I need to check with IT to see if there's a way that it can be adapted to plug in and show you on screen share. But face to face, I would always show it. I mean, laser disc, it was like big as a LP. It had 25,000 images on it of any and everything about it could happen to the human body. And it has lots of images of herpes simplex 1. And if you think of it as kind of mild, you should see some of the gosh awful images of babies that have it, particularly if they're infected with it, almost at birth. And I've seen, grandmas and aunts and all of that slobbering over little babies and have a cold sore. And if they do that before that immune system kicks in, it can be devastating. And so you might Google it sometime, herpes 1 in infants or newborns, and it's really sad. Scar them for life, literally. And there's one, and I guess I don't know how to put this delicately, but let's just say that if someone has a cold sore, you need to be careful where you let them nibble, because we have the receptor sites pretty much everywhere. And I wasn't able to show it last semester, but there was an image on the laser disc. And we talk about these viruses that are sexually transmitted and the viruses and where they attack, the laser disc images show it right there where they are. And let's just say that if a baby had it, a nursing baby had it on their mouth, can you figure out where the nursing baby would transmit it?
Ooh, a nipple.
Uh-huh. And so on laser disc images, it showed a person that those were disaster areas from herpes simplex 1. And I don't think it was from a nursing baby. So, yeah, put that the virus hides out near the spine. It hides out near the spine. And anything that lowers the immune system can trigger an outbreak. So why are they called cold sores and fever blisters? So sometime when something else is, stressed your immune system, and so just put illnesses, and that's why it's called cold sores and fever blisters. But here's two that most people aren't aware of. Fatigue. Fatigue can cause it. Does that mean if you're burning the candles at both end and in the middle, that it can trigger a fever blister? Yeah. Stress. Stress is a big one. Stress always suppresses the immune system. And ultraviolet light. Ultraviolet light triggers the outbreak of cold sores. And here's the mechanism for it, and you don't have to get this down. Ultraviolet light suppresses your immune system. And can you figure this out? You can get cold sores from skiing. Can you figure out the two mechanisms that could occur that way? Two things I've just talked about, you can get cold sores from skiing. So if you're there at the ski lift open and you skied hard all day long till it closed down, could that possibly do it? If you get so fatigued. Are you aware that if you go to the beach, you kind of get a double whammy of getting a sunburn? Anybody know that mechanism? So you get the ultraviolet radiation coming down, then it can reflect off the sand, off the water. Well, if you're up in the mountain at like 10,000 feet or so, you have snow and there's less atmosphere. And so you actually receive more ultraviolet radiation, plus it's bouncing off the snow. So you're goggled up, you got a cap on, you covered up, but usually your lips are exposed. And so that can do it. Okay. Put that there's no effective treatment for the common cold, but for herpes simplex 1, but I'm going to tell you some things that can work. There's an antiviral, and it's used more for herpes simplex 2, but if it was really severe, we'll go ahead and introduce it. They're normally not prescribed, but if you look up how bad some cases can be, it would definitely warrant using this. So if you have a little one and it's really severe, the first medication, now it's in generic now, and I'm going to give you the generic name, acyclovir, acyclovir, acyclovir. I think I spelled it right. If I'm writing it on the board, it's easier. There's obviously no vaccine for herpes simplex 1. Okay, I believe that's all we need on that one. Let's do herpes simplex 2. Herpes simplex 2. It's commonly known as genital herpes. But put that we have receptor sites other places on the skin, so it can be transferred other places as well. And the laser disc images have some pretty nasty instances or images of cold sores on the lips that has a little different look from herpes simplex 1. And I think you can probably figure out from what we've already talked about how they can get pretty much anywhere. And so there's no such thing as safe sex, and we cover HIV, you'll understand that. But anything that can be transmitted sexually can be transmitted orally. And you can get about any, all you cannot get that way is pregnant. Everything else that can be transmitted sexually can be transmitted orally. Okay. Yeah, put that the lesions have a different appearance to them. They can be quite painful. And I told you need to get in, just Google and look up the images of these things, since I'm not able to show you my laser disc. And so just Google herpes simplex 2. And we have some images that, yeah, is really bad. I guess next you need to put down that if someone has had herpes simplex 2, it's best to not have a vaginal birth. It's one of the Torch diseases. Let me tell you how to spell it. It's capital T, little o, capital R, capital C, capital H. And underline the H. The H is the herpes simplex 2. Now I think they arranged them in that order. You heard of passing on the torch. So torch diseases are diseases that can be passed from mother to offspring during pregnancy or during birth. The torch diseases can be passed on during pregnancy or during birth. Put that lesions cannot always be detected. Are you familiar with the term asymptomatic? And so the majority of people, of females that have herpes simplex 2, and I think the percentage is high as like 75%, but just know that the majority of women that have herpes simplex 2 may have no symptoms. And A&P, did your textbook have close-ups of the lining of the vaginal wall? And since it has to stretch so much to accommodate childbirth, there's ridges and ripples in it. Do you remember ever seeing pictures of it? Well, if not, there are. And so the lesions can be down in those wrinkles or folds where they're not visible. So you can have a pelvic exam and not be visible to the naked eye. And that leads to problems. And so put that if a baby is infected going through the birth canal, so if a baby is infected at birth, it can lead to a complete body rash. And if you Google herpes rash at birth, it's terrible, a red all over the body. Put that it can infect body organs, damage body organs, and it can even cause death. So did you catch the sneaky part about this virus? Did you put all that together? Does this mean you could have absolutely no symptoms at all, have a pelvic exam, it could be missed, and your baby could be infected with it, and you've had no symptoms at all? And so this is not rare at all, and it's devastating. It can cause death. There's no vaccine for it, so you can't protect yourself, and it's super common. I'll tell you what, somebody Google right quick, how common is herpes simplex 2? And I think you're going to be shocked. How common is herpes simplex 2? Now, you don't have to put this down, but I just want you to just see how rampant it is. If somebody can find that real quickly. Anybody find it? Okay, let me see
1
Rosalia.
in 5 women.
I'm sorry, I was talking what?
1 in 5 women and 1 out of 9 men.
Yeah, that's 20%. And 1 out of 5 be 20%. Okay, let me get Rosalia Mark present. We don't have Bethany or Casey. Okay. So you just need to be aware of how common it is. So you mean you could have sex with someone, they have no symptoms at all, and you could get it? Yes. Next, put that just like herpes simplex 1, if you ever get it, you carry it for life. Now, it's more likely to be treated with antivirals than herpes simplex 1. So let me give you the newest antiviral that's used against it. And I don't know if it's in generic now. It must not be, because I think a series of treatment is like over $300, maybe for like 10 days, but you don't have to put that down. And it's called Valciclovir. This is just Valciclovir, Valciclovir. And so the acyclovir was the first one. And this one is much better. It's quite expensive. And if you've heard the trade name, all you're responsible for is the actual chemical name, acyclovir and valciclovir. If you've ever heard of Valtrex, that's the first one. And if you've heard of Valtrex, that's the second one. Any of you familiar with ever hearing Valtrex or Zovirax? Nobody's ever heard the terms? Now, it can be used against other virus diseases, but that's a big one that it's used against. Okay. Herpes simplex 2. We got transmission, treatment, that's transmitted, receptor sites. Okay, I left out something on herpes simplex 1. You need to go back and put that. This is 1 now. Go back and put that. We said anywhere on the body, but I didn't specify this one. On herpes simplex 1, put that the lesions can even be on the eyeball. This is 1. It can be on the eyeball, and it's very painful. It hurts when you blink. My dad had problems with it after he had cataract surgery, and they used anti-inflammatory drops in his eye after having cataract surgery. That suppressed his immune system. From then on, he had attacks of it on his eyeball, and he just had one good eye, and it was on his one good eye. And when they finally figured out what was damaging the vision, the herpes was actually getting in his cornea, and it wasn't painful there. And we almost lost that one eye until we finally found what it was. I found an ophthalmologist in Tyler that finally identified it. And so he took acyclovir from that point on, a low dosage every day. Because he was, I think that happened when he was about 99 or so, and he lived to be 102. So he was on that the rest of his time, and put the herpes 1. It's very rare, so don't panic now, but this is herpes 1. It can cause a fatal brain infection. It would be herpes meningitis. And I had some laser disc images of the changes it made in a brain scan. It's super rare. So if you've had cold sores, don't, I'm going to die. No, it's very rare, but you need to be aware that that's the case. Okay, that's herpes 1, herpes 2. And when we cover another virus, there's something that could have been done that would have greatly reduced the chances of 1, and I think 2, but we no longer do it. So we'll hit that when we get there. Believe that's all you need on 2. Okay, let's go to another one that Sarah mentioned. Let's do the hepatitis. Hepatitis. Did you learn A and P what HEPA referred to? What's HEPA referred to?
Hepatitis?
No, just the Greek term, Greek or Latin term, HEPA. You had some terms in A and P. What organ was it referring to?
The liver?
The liver, yeah. So hepatitis literally translates to inflammation of the liver, or in this case, infection of the liver. And there's multiple different strains of hepatitis. There's A, B, C, D, E, F, and G. We're going to do A, B, and C, because that's the ones that most is known about. And none of you are old enough to know, but for a long time, they didn't know about hepatitis C. They knew about A and B, and so there was A and B, and then there was one they simply called none A, none B. It wasn't either one, and it's since been found to be hepatitis C. So let's take them in alphabetical order. Let's do hepatitis A. Now, I like the old terms better, because does A or B or C tell you anything about the virus? No. And so maybe put this in quotation marks. Hepatitis A was earlier called epidemic hepatitis. It's not an official name, but it's more descriptive. Does that imply it could be spread easily and extensively? Yes. And so it was, and it still can be. Okay. It's fecal oral transmission. Fecal oral transmission. And here's a corny crutch, and we can tie the letter to the exit point. And so if you think of A is the one that exits through the anal orifice, you won't ever get them mixed up. So if it exits the A anal orifice, that makes it fecal oral. And it's one of the many reasons, but a big reason, when you go into some restaurants, fast food places, there's a sign by the door as you exit, or maybe it's on the door. And what does it tell the employees to always do before returning to work? Wash their hands. And so hepatitis A is a big one that that food workers have spread it extensively. It was probably about the time some of you maybe started the school here in Athens. Are any of you familiar with the epidemic of hepatitis A that occurred in Athens probably 20 years ago or so? You don't have to put this down, but the building's still there, but there was a Jack in the Box out on 31 East. It's what? Yeah, okay. And I don't know how much longer it lasted, but a worker there had hepatitis A and they spread it all over Athens. My daughter was teaching second grade at the time at South Athens Elementary. And all the teachers' chores every morning was to go around and look at a certain part of the body of all of their students. And almost every day every teacher was sending kids to the nursing station, and it spread. And once it spreads, then the people that get it spread it. It got so bad that they vaccinated every kid in the Athens Independent School District. The teachers had to pay for their own vaccination. It was rampant. And yeah, let's do symptoms next. If it affects the liver, can you kind of figure out the kind of problems it would cause? What condition were the teachers told to check for, and what part of their body were they looking at? It's the first place that this condition shows up.
Their eyes?
Yeah, the whites of their eyes. What color? Anybody know what color?
Yellow?
Yellow. You know what it's called?
Nope.
Jaundice.
Very
So
good.
one of the first symptoms is jaundice, and it's a yellowing of the eyes, and then it can go on and even yellow the skin. And so anything that damages the liver can cause that. If you have liver cancer, you turn jaundice. Sometimes premature babies, their livers aren't fully developed. They're born with jaundice, and they put them under ultraviolet light with cool little sunshades on to clear that up. It can cause abdominal pain. You remember how big the liver is, don't you? And so the abdominal pain is from the damage it does to the liver. It can cause malaise. We use that term for the common cold. I mean, you feel rotten. Now, there can be other symptoms, but put that it can damage to the liver to the point it can cause death. So hepatitis A can kill. It usually doesn't, but it's possible. It can kill. Here's the thing about hepatitis A that separates it from the other two, but that hepatitis A does not relapse. A does not relapse. So put the not there. It does not relapse. And it does not increase your risk of liver cancer. So if you're going to have hepatitis A is the one to get. Not that you want it. Now, I'm going to give you the kind of the history on it, and you don't have to put down how it used to be. So before there was a vaccine, if you knew you were exposed, and I can remember when this would be announcements on the radio and maybe TV. And I know at one time, somebody on Interstate 35 that worked at a restaurant, it was a real popular place. And I think it was around Georgetown or Salado, along in there, but it's a super popular place. They spread hepatitis A from Dallas to San Antonio and beyond. Infected numerous people, hundreds and hundreds. Anyway, in the old days, you'd hear announcements that if you've eaten at restaurant A and they'd give a time spot, you need to see your physician, and they would give you a gamma globin shot. It was just an immune protein that would kind of beef up your immune system. And that was before there was a vaccine. Now, as we progress now, we had a vaccine. And then here's what the older policy was, that if you're going to travel to an area where it's endemic or common, or if you know you've been exposed, like they make an announcement about a particular eating place, that you get it. Okay, now let's bring it up to present. Put that now it's one of the childhood vaccines. You don't have to know any of that past history. So now it is a childhood vaccine. And so we'll have a generation now that is going to be immune to it. So still, if you travel on vacation to a part of the world that their water treatment system is not the best in the world, it'd be good if you haven't had it. And if you're going into the healthcare business, maybe it'd be a good idea too. But so B, hepatitis B. And if you want to kind of put this in quotation marks, it helps you keep it straight. You can put bad in blood. B is bad and it's transmitted in the blood. So transmission is different. Transmission is body fluids. The symptoms, you can ditto all that about hepatitis A. There's jaundice, there's abdominal pain, there's malaise, there's liver damage. But here's the big difference. Put that hepatitis B relapses. Hepatitis B can relapse. And put that damage accumulates. So every time you have a relapse, it damages the liver, and that damage is never completely healed. And so that liver damage can result in death or the need for a transplant. Now, would a transplant cure hepatitis B? No, it just prolongs life. Here's the other difference from hepatitis A. Hepatitis B can trigger liver cancer. Now, you understand why I say B is bad? Let's be more specific in the transmission. And we'll see these again in some other viruses. And we're going to specifically mention all the body fluids. And these are going to be kind of in three different sections: the highly infectious, the probable, and then, well, not really that much of a risk. And so here we go. This first group are kind of equal, but some would be higher than obvious than others. Blood. So anytime there's blood exposure, there's a chance of hepatitis B. Semen, there's blood in semen. Female mucous material. And obviously around a certain time of the month, it would be highly infectious. So from that, is hepatitis B sexually transmitted? Can it be? Yes. Next, and this is sad, because sometimes the baby would miss it and then it would be infected. So from what we just said, would it be a high chance that a mother could infect a baby with hepatitis B going through the birth canal? It's a bloody issue. And for scratches on the body, yeah. And so the last one is really sad. If they survive that and don't get it, put the virus is in mother's milk. All milk contains blood from the mammal that produced it. You mean if we drink cow's milk, we're getting some cow blood? Yes. Now, those are all highly infectious. And so can you see that sharing IV needles, when they jack the needle to make sure they've got it in the vein, tattoo parlor that doesn't use new needles and new ink every time. If you've watched any kind of sporting event, now, we should have been taking these precautions when we learned about hepatitis B, but it wasn't until another virus came along that we'll cover in a minute or later that they started practicing this. If somebody at a basketball game, drives to the basket and gets an eyebrow or something cut, do they just wipe it on their jersey and keep playing? No, the game stops. They disinfect the floor. The trainer comes out with gloves on, and sometimes they have to go back and get it stitched up, and they can't go back out until they get the bleeding stopped. And so let's go to these others. So we got that group. And the next group is obviously different conditions could make these highly infectious. So these aren't in any particular order. Vomit, feces, urine, wound secretion. Now, you don't have to put it down on each one of those, but is it, and so feces, urine, vomit, can you think of the conditions that would make those highly infectious? You don't have to put all these down, but if somebody had a bleeding ulcer, wouldn't their vomit be loaded with it? If they had bleeding ulcers or bleeding hemorrhoids, the feces could be loaded with it. If somebody has a urinary tract infection, can there be blood in the urine? Yes. Now, normally urine is sterile, but wound secretions, it may not be bleeding. Yeah. And so all of those, probably people have been infected by those. Now, the next one, put in this same group, saliva. And I think you can think of the conditions that would make saliva highly infectious. Can you have bleeding gums? And sometimes you don't know you have bleeding gums, then you haven't been brushing or flossing regularly, and you brush and you have a pink toothbrush. Now, you're not gushing blood. Oh, you mean you could get hepatitis B from swapping slobber and tongue wrestling? It's possible. Put it, we put this later. Okay, let's do the last ones. And these are way down the list. So this is the third group, and it's highly unlikely on these. And that would be tears and sweat. Those would be way down the list. But there might be conditions of eye infections if possible, but tears and sweat are way down the list. But now let's put this down. Put that hepatitis B is more infectious than HIV. That means it takes fewer viruses to infect you with hepatitis B than it does HIV that causes AIDS. So put that we should have practiced universal precautions. Whereas the health community should have started practicing universal precautions when we understood how hepatitis B was transmitted. But we didn't, or they didn't. It wasn't until HIV came along, and so you don't have to put that down. We'll cover that later. But whenever they started practicing universal precautions against HIV, Guess what happened to the in-hospital and what clinic transmission for hepatitis B? It went down. Now, let's go ahead and put down what universal precautions mean. That means, and I hope that all of you that are going into any area of healthcare, start this. You assume any and all body fluids are infectious. That's what universal precautions mean. You just right up front, you treat them as you assume that any and all body fluids are infectious. And when we get to HIV, we'll pinpoint what those specific procedures are. But there is a vaccine for hepatitis B. And before you'll be able to start nursing school and do clinicals, you'll have to receive all three. Have any of you already gotten all of your 3 hepatitis B vaccines? Any of you? Okay, Sarah has. And so before you can do any clinical work and be exposed to patients any shape, form, or fashion, you'll have to receive it. This is something that, as I've asked my students in the past, fewer of them knew this than should. Everybody that's ever been given one should be told this. There's no guarantee if you receive the 3 vaccines that you're protected, but that you have to have an antibody test. And so before you start your clinicals and you're vaccinated, if they don't tell you, you need to ask and you need to be tested for antibodies. Now, true, it's rare, but there's instances where someone would have all 3 shots, they assume they're protected, and they become infected. So insist that you be tested, and if you do not exhibit the proper level of antibodies, guess what you have to do? You have to do it all over again. But don't put yourself at risk. This is a life-threatening condition, and we talked about the transmission. You can take it home to your family. Yeah, if you get if you're infected with it, you're going to know it. You're going to have symptoms. If you're infected with B, you know it, you will have symptoms. Okay. Now let's go to hepatitis C. Hepatitis C. And here's kind of a corny crutch. Does C rhyme more with A or with B? B. So you can ditto pretty much everything for C that you saw on B. It's transmitted all the same ways. You have all the same symptoms. It relapses. It can increase your risk for liver cancer. But here's the sneaky part about it. Many cases, hepatitis C is asymptomatic. And there's a silent epidemic in this country of hepatitis C. Does that mean you could be tongue wrestling with somebody, having sex with somebody, they have no symptoms, and they could give you hepatitis C? Yes. Okay. Yeah. I've had 2 students that have done this and came back and told me otherwise, that there's a way you can check and to see if you are positive for HIV, hepatitis B, hepatitis C, and it's a community service. Does anybody know what it is? donate blood. Now they're going to ask you, anybody donated blood in recent years? Anybody donated blood?
I have.
Okay, kind of give them an idea of how intrusive questions they ask you.
They just kind of ask you like if you've ever had anything like that or anything in your blood. They get like a full medical history before you do it.
Did they
I've
ask
tried
you-
to donate
Remember
blood.
the specific questions.
Yeah, I mean, you have to fill it out. I mean, they don't actually ask you, but it's on the survey thing.
When I
Question.
went, they like were asking us.
Did they ask you anything about your sex life?
Yeah, they asked like if I was like straight and stuff.
Yeah, now, so, and I've had two students that figured that had some wrist exposure and they donated blood and they came back and told me that they tested positive for hepatitis C that had absolutely no symptoms at all. But it's good to know, in both cases, their exes had brought it home to them, and that's why they were exes. They had been out, cheating on them and brought it home to them. And so now they carry it for life. There's one minor difference here about this. Put this down, put a star by it. And I hope it will bring that statement about universal precautions home to you. There is no vaccine for hepatitis C. There's no vaccine yet. So what's your only protection against hepatitis C?
Abstinency.
Universal precautions. And it's risky out there in the dating world. Yeah. Because there's so much of it that is asymptomatic. There was something else I was going to do on hepatitis C. Oh, okay. There's treatment for hepatitis C. And I hesitated to use this term for a long time, but apparently it's been successful. Now, it's a combination of medications. And let's just I'll go this far, they're claiming that it can be cured. And so, but at least that there's medications that can treat it. And I don't know if I'd go as far as, but I guess there's enough history now to say that it can be cured. And if it's cured, then I assume that you couldn't transmit it. The tricky part is all those people out there that have it and don't know they have it, and they're not taking medication to get rid of it, and they're out there spreading it. Okay, that's all you need on hepatitis C. No vaccine. And hopefully there will be at one point. There's a country western mother-daughter group. I don't know if they're still performing or not. And the mother came down with hepatitis. And it was the mother, and I forget which is the mother and which is the daughter. The judge, Naomi and something. Yeah, but the mother in an earlier life had worked as a nurse, and it was finally determined that it was hepatitis C. And so she had gone years and years and years from when she actually, worked as a nurse. And she had to quit touring there for a while, and it was quite severe. But I think she's doing okay now. But those are out there. Let's do one now that is more common than you realize. There's 100 different strains of it, and it starts with an H. HPV. HPV. human. I don't know if I can spell this without writing it on the board. I kind of do that automatically. Human papilloma, P-A-P-I-L-L-I-L-O-M-A. That's close enough. If I'm putting it on a whiteboard, I can do it. Human papilloma virus. But there's about 100 different strains of it. All of them cause warts. All of them cause warts. Some people think HPV is the one that causes genital warts. No. All HPV cause warts.
How many strains does it have again? Sorry.
Approximately 100 different strains of HPV.
Okay, thank you.
And on the laser disc images, there's tons of images of people with warts, and they have got boodles of different appearances. And the reason for it is there are so many different strains. Yeah, there's approximately, put this down, there are approximately 30 strains that can cause cervical cancer. Now, I don't know if all the strains have number designations, but I know some of them are. So with this strain 6 and 11, I believe it's 6 and 11. I'll go ahead and check that. Cause 90% of genital warts. 6 and 11 cause 90% of genital warts. I know this for sure. Strain 16 and 18 cause 70%. 16 and 18 cause 70% of cervical cancer. And 73% of throat cancer. Is cervical cancer pretty high up on the list of types of cancers? Yes. 70% of it's caused by this virus. Yeah, since I've learned about the throat cancer, the numbers have gone up, and this number is probably a few years old, so it's probably higher now. So when I first started doing it, like every year in the United States, there were like 12,000 cases of throat cancer that were caused by HPV, strains 16 and 18, the same strains that cause cervical cancer. It's gone from 12,000. The last time I checked, it's up to 14,000 a year. Now, that's not 14,000 cases of throat cancer. That's 14,000 of throat cancer that's caused by strains 16 and 18. Can you figure out any connection between the same strain that causes cervical cancer causing throat cancer? Remember what we said about something a minute ago? Yeah. And I think it was Michael Douglas, when he was diagnosed with throat cancer, he figured that the general population didn't know the risk of that particular practice. So he came out and admitted that that's how he contracted human papillomavirus that led to his throat cancer. And it's just not well known. So it's not a safe form of sex. It's only safe and you can't get pregnant that way, but you can get everything else. We lost an instructor here at the college from throat cancer, and knowing kind of his history, I would almost, bet a coat that it was HPV. And so it's rampant. So if you know someone's got throat cancer and they don't dip or chew, there's a good chance that it's caused by this particular virus. But there is a vaccine for cervical cancer. But at first, it was only available to females. But it's now available for males. It can cause cancer in males, cancer of the penis, and there's some others. But for a long time, only females could get it. And does anybody know there for a long time, you could only get it up to the age 24? Has that been changed? Does anybody know? You don't have to put that down. Like, you're going to quit having sex when you're 24? You know, I don't think so. But yeah. And CETA started bringing in articles of extra credit, and it was talking about there may be a vaccine for, cervical cancer. And I know you can take your own melanoma type of skin cancer, and a vaccine can be made from that to treat melanoma. So I thought it was probably something like that. And then when it finally came out, it was a vaccine against HPV, strains 16 and 18. So put this down, there's a vaccine, and put now that the vaccine contains strains 6, 11, 16, and 18. 6, 11, 16, and 18. And mothers were up in the air. And you don't have to put this history down, but the governor of Texas at the time was, you don't have to know the name, was Mark White. And it seems that he had some connection with the company that made the vaccine, may have been a big stockholder. And he would yeah, get rid of this amphibian in my throat. And he was going to make it mandatory in Texas that all girls, I think like 8 years old, receive the vaccine. And it hit the fan. Mamas were up in the air. We had a meeting here over in room 208. There was a representative from the company that made the vaccine. We had Dr. Baumgartner's wife, it's OBGYN locally. We had the person that was the director of the ARC here, the Methodist group, and me, and I believe that was it. Anyway, it was open to the public, and there was a bunch of mamas there that were upset. And our Dr. Baumgartner, I said, you think it would help if I hooked up my laser disc images and showed them my pictures of cervical cancer? And he said, I think that might be a little too graphic. But I had talked to the OBGYN, Dr. Baumgartner, and I asked her, now what's the youngest person that you've worked with that had this? And she said, I had a girl that she came in, delivered a baby. I think it was her second or third baby. She was 19 and didn't come in for prenatal care. She just came in and she delivered her baby. And she had bad case of cervical warts. And she told her, she needed to have it checked out. She eventually did. She had cervical cancer and she died at 21. And, but she didn't tell, this to the mothers. And so after it's over, I asked her, would you mind telling them about your cases that you've seen? Oh, no, she did tell that. But she didn't tell this. And said, would you mind telling the youngest that you've seen genital warts in? And she said, I've seen it in girls 14. And anyway, before it was all over, those irate mothers that were just having a hissy fit that their daughters are going to have to be vaccinated, that it was going to make them promiscuous, they were up there making an appointment with Dr. Baumgartner to get their daughters vaccinated. And when we cover AIDS in a video for long, you're going to see a doctor that's in one of the major cities that has a van that he treats, and he talks about that there's prostitutes on the street that are infected as young as 14, infecting their customers, and they won't know it, for much later. So, okay, so there's a vaccine for it. It's rampant. Now, if you heard my numbers, if you get vaccinated for HPV to prevent cervical cancer, is that a guarantee that you can't get cervical cancer from HPV? Did anybody catch what I gave you right at the beginning, that that's not complete protection?
Too many different strains.
Yeah, there's 30 different strains. And so more than likely, as they find other strains and identify them, they'll probably be putting those strains into the vaccine. Now, it greatly reduces it because 70 and 73% are caused by those two strains. So it should reduce the incidence about 70 and 73%. But that's not complete elimination, but it's a big improvement. Okay, is there any more H's besides HIV? Check your list. We don't have time to start HIV, but we can do some of the lesser ones. Let's do this one. And I'm going to screen share this one just to show you a corny crutch. And I'll see if anybody remembers this, because